Mr. Speaker, President Trump and congressional Republicans are not leveling with the American people when they say no one will be worse off under this repeal bill. TrumpCare dismantles the health and economic security that millions of hardworking Americans have gained over the last 7 years, and it should be defeated. There's a reason this bill was hatched up in the back rooms only to be finalized last night, and that's because congressional Republicans did not want the American people to see what was in it. TrumpCare provides less coverage, fewer protections, and higher costs. TrumpCare is Robin Hood in reverse, taking benefits and financial assistance from hardworking middle-class Americans and our most vulnerable in order to give tax breaks to the wealthiest and the corporations. TrumpCare cuts a combined $1 trillion from Medicare and Medicaid. These cuts are devastating, Mr. Speaker. TrumpCare will ration care for the 76 million Americans who rely on Medicaid, including seniors with long-term care needs, Americans with disabilities, pregnant women, and vulnerable children. I fear for seniors, Mr. Speaker, those in nursing homes. When states get less money, what will they do? They'll give less money to nursing homes. We'll go back to the days that I remember in New Jersey when nursing homes were terrible places, where there weren't enough nurses, where there were fires because of lack of maintenance of the nursing home. Working families are going to pay more for less. They'll see their premiums and deductibles skyrocket. My GOP colleagues talk about high deductibles and co-pays. Well, you ain't seen nothing yet. You're going to see that this repeals the limits on deductibles and co-pays that exist under the current law. Out-of-pocket costs are going to go through the roof. The deductibles will go even higher. The co-pays will go even higher. The out-of-pocket costs will go even higher. And the bottom line is Americans between the ages of 50 and 64 will pay an age tax and be forced to pay premiums 5 times higher than what younger people pay for their coverage. I've heard my colleagues on the other side say, well, that's only fair. Well, I don't think it's fair that seniors should have to pay a lot more, that those between 50 and 64 should have to pay a lot more. But also, TrumpCare leaves the sickest and vulnerable Americans at the mercy of insurance companies, allowing them to charge a 30% penalty or sick tax for those who are unable to maintain continuous coverage. So if you fail to pay your insurance for a month and then you want to get it again, even if you have a pre-existing condition, which is often the case, you're going to pay a 30% penalty or sick tax. I don't think that's very fair. And last night, in order to garner votes from the extreme right and their party, House Republicans added a provision that eliminates protections for essential health benefits. Now, maybe people don't understand that, but let me explain it. The ACA ensured that when a consumer purchased health insurance on the individual market or gained coverage through Medicaid expansion, that their plan would cover 10 critical essential benefits. TrumpCare eliminates this guarantee, meaning that unscrupulous insurance companies can sell skeletal plans, junk insurance, without benefits for hospitalization, maternity care, mental health, drug treatment services, and Americans won't even know what they're getting. They won't realize that they have worthless insurance until they get sick and it's too late. The bottom line is this bill should be defeated for so many reasons, because so many more people will not have health insurance, because their costs are going to go up, and because they won't even know what insurance they're buying. We're going to go back to the old days of the Wild West when insurance companies could sell whatever junk insurance they want, and the public won't even know what they're getting. It's a disaster for the American people. I urge my colleagues to vote no.